Refusal of treatment is one of the most controversial topics among the medical community, specifically in the instance of refusing blood transfusions. In particular, one group of people is known for this, Jehovah's Witnesses, who reject blood transfusions on a scriptural basis. This is often, though, in conflict with the doctor's interest of saving the patient's life at whatever cost they deem necessary. This is an extensive topic that could be discussed for hours, but I'm going to boil it down to the most important points here. Those are the risks that blood transfusions do in fact carry, the safe alternatives to transfusions, and most importantly, your fundamental right to decide what treatment you want to receive. My goal at the end of this presentation is to inform you on the risk of blood transfusions and the alternatives so you can make a decision on your own, and to inspire you to stand up for what you believe in the surgery room. The first of these points that I mentioned is the risk that blood transfusions carry. Despite the fact that doctors use these, it's commonplace in the operating room. It's commonplace in the operating room. There are many risks that come with this. I'd like to share with you an experience that demonstrates this. An article by an awake writer in Nigeria entitled "Is HIV Screen Blood Safe?" written in 2008, found on jw.org, which has many sources, reliable sources on blood transfusions, highlights the experience of a young girl in Nigeria. She was given a blood transfusion due to medical complications at a very young age, and the blood had been tested, screened for HIV, and found negative. Despite this, shortly after the procedure, the young girl tested positive for HIV. The culprit? The ensuing government investigation determined that the most likely culprit for this was in fact the transfusion. So even if blood may appear clean and untainted, such as the blood in this illustration here, that is not the case, even if it has been tested and found to be clean. This is only one of the risks involved, and there are many others, such as the immune system rejecting blood of the host. Are there ways to avoid these risks? That is my next point, the safe alternatives to blood transfusions. As demonstrated in the picture here, this is one of the procedures done to avoid blood transfusions where parts of the patient's blood are filtered out and back into the patient's own body. I won't go into the medical details of this because that can take forever and there are so many different options, but there are many safe and viable alternatives to blood transfusions. In an article by Dr. S.Y. Tan from Family Practice News in 2012, it highlights your right to refuse treatment and how it's up to you. You don't have to accept blood transfusions, but rather you can choose one of these safe alternatives. In fact, Jehovah's Witnesses are actually changing the medical community by rejecting blood transfusions. Another article discusses this from the New Yorker by A. Schaefer. It discusses how many doctors, after having worked with Jehovah's Witnesses who did not accept blood transfusions, have actually ordered less blood in their ensuing patients, even the ones that are willing to accept blood. Why is this? The reasons the doctors cite is that blood transfusions are widely overused in the medical field, and these safe alternatives often lead to better results. These alternatives are something that should be heavily considered, and it is your right to accept them. Unfortunately, not all doctors are as open to bloodless surgery as the ones I mentioned above. In a case by Allison White in a nursing journal from 2019, this year, there was a case in which a patient who had expressly made their wishes known to the doctor to not receive a blood transfusion had fallen unconscious and been forced into a transfusion by the doctor. Unfortunately, in this case, the court ruled in the doctor's favor, and the article overall is sympathetic to the doctor as he was trying to save the patient's life. However, it does not acknowledge the point that the doctor was not respecting the patient's wishes. In many cases, doctors will pressure patients, even ones who are not unconscious, to accept blood transfusions. The cases do not always go like this, however. In another similar case, highlighted in the New Yorker in an article from 1996, same scenario where a patient was forced a blood transfusion, the court ruled in the patient's favor for their rights because the doctor had violated their right to choose their own treatment. It's really up to you to accept this treatment, and as the points I have brought out above, the risk of transfusions and the alternatives, you may have changed your mind on this, or like myself, you might have already made it up in your heart from a biblical and spiritual standpoint to reject blood transfusions. In either case, you should stand up for your legal right to choose the treatment that you wish to receive. Before I conclude, I would like to bring out a visual aid that many Jehovah's Witnesses are likely familiar with, and that's a blood card or advance directive for healthcare. This is a document in which you can carry around that highlights your medical wishes so that you can be prepared in case a situation arises in which you are not able to explain to the doctor what kind of treatment you wish to receive. Having this is crucial if you wish to have your medical wishes respected by doctors. And hopefully, if you choose to stand up for your rights, many doctors will learn from this example and maybe in the future not pressure their patients to accept treatment that they do not want.